I look at the website for finding a doctor in Alberta, and searching Grand Prairie every day. That's one of the first things that I do when I get up in the morning.
Despite his best efforts, Jay Storley hasn't had a family doctor for about 3 years, but he typically requires monthly appointments to manage a health condition.
I have to go either to emergency, which is usually a wait, and I've waited there sometimes for 12 hours.
Nearly 800 kilometers away, one family doctor is feeling the same crunch.
Our phone is like 911, like never stop.
Dr. Nassim Arouj has owned a family medical clinic in Fort McMurray for 10 years. But in all that time, he's never been able to recruit another permanent family doctor to join the practice.
I'm exhausted, so I'm at the stage of burned out.
To keep up with demand, Arouj brings in locum doctors. But between travel expenses, arranging accommodations, and vehicles, it's costly.
Clinic is not profitable.
Across northern Alberta, communities are struggling to find and retain doctors. I talked to experts who say Alberta's fee-for-service funding model is part of the problem. Right now, family physicians aren't paid for things that happen after the patient leaves the appointment, like reviewing lab results or filing paperwork.
It became apparent that some of our family physicians were indeed struggling.
To tackle this issue, the province has been working with the Alberta Medical Association to come up with a new funding model, one that would allow doctors to be paid for additional services.
It'll allow us to retain the docs we have and then, of course, start to be competitive to recruit new docs in, and that's going to be the key.
It's also been found that medical students are more likely to stay where they've been trained, so the province is investing in expanding medical programming in rural Alberta, pairing the University of Alberta and University of Calgary with schools in Lethbridge and Grand Prairie.
It doesn't help to simply add new seats in urban centers. What we really need to do is think about how do we create admission criteria that selects students who might want to practice rurally? How do we think about, ensuring that we have curriculum that reflects rural practice and team-based medicine, which is much more common and necessary in rural contexts.
And Fort McMurray's college is also trying to get in on the deal.
If you really want to look at bringing people to rural communities, northern communities, remote communities, Fort McMurray is one of the ones we have to seriously consider.
And while steps are being made to retain more rural doctors, the first batch of graduates won't be coming for years. Without an influx of doctors soon, Dr. Arouj may not keep his clinic open.
The leases, I have four more years for this lease, and I'm quite hesitant to renew the lease if I don't see any fixed plan.
And if offices are closing, finding a family doctor won't be getting any easier.
A lot of people are suffering. A lot of my friends don't have doctors.
Jamie Malbuff, CBC News, Fort McMurray.